Good morning and welcome to Medicare Monday. So this is our last Medicare Monday of July. I am Melanie Garland and I am joined by my co-host, Miss Susan Spilly. So good morning, everyone. Thanks for tuning in. And we're excited about today's presentation because we're kind of presenting on presentations. So how fun is that? So we're excited to share with our viewers and all of you out there watching today, and maybe you'll know of someone or think of someone that could watch this video at a later time. So just know that all of these are saved to our page. But our purpose of today is just to inform you of the different topics and the different events and the different services that we can provide as SHIP through public presentations. So I think, Susan, we'll just kind of dive right in, and I'll get this PowerPoint pulled up. And while I do that, we just want everybody to know that if you have any questions or comments or anything, we're both live monitoring our presentation in the comments. So please just say hello, let us know you're watching. And if you have any questions, feel free to ask. So let's get this going here. All right. So we're just going to talk a little bit about the presentations that we offer, not only by SHIP staff, like individuals like Susan and myself, but we also have volunteers and SHIP counselors statewide that will do presentations through our program as well. Okay, Susan, I'm going to turn it over to you.
All right. Well, we do all kinds of presentations these days. We've always done the in-person presentations, but when the pandemic hit, we weren't going anywhere. And so we had to pause and rethink how we were going to reach folks and let them know some important information about Medicare. So we started doing virtual presentations, and that is how Facebook Live presentations were born, basically as a result of the pandemic. So we offer both in-person and virtual at this point. And we also not just talk to Medicare beneficiaries, but we are the impartial, knowledgeable source of Medicare information. And so we're used a lot for professional development, where groups of people who may work with Medicare beneficiaries, they're not quite sure of some Medicare rules, some very specific things. We tailor each presentation to our audience. And so we are available and happy to conduct the professional development kinds of presentations. And we do try to make our presentations interactive because let's face it, folks, who wants to listen to somebody blab on about Medicare for 45 minutes, an hour, or an hour and a half? It's much better if we can share stories and ask questions and get some help from the audience, if you will. And so we try to build in some interaction at every one of our presentations, whether it's a virtual presentation or an in-person. Then we are at different kinds of health fairs and senior events and community events with our show on the road, our dog and pony show that we take on the road. And I think one of the things that if somebody knows about SHIP and has seen us out in the community, perhaps they have picked up one of our giveaways or promotional products, and they come back for another one. When I work a booth, that we've been at that event consistently over the years, I have people come up saying, oh, I need a new one of those pill boxes, or I need some more of that hand sanitizer, or I need some new notepads of paper. We have some very creative, helpful giveaways, and we always have a booth that has lots of choices. And so it makes us pretty popular when we're at community events.
Absolutely. Yes. I have lots of people that come back for the notepads and the pens. I think people can just never get enough of those. So we had to share a photo of Megan today because she's not on with us today. But this is Megan doing what she does best, right in action, doing a public presentation. And this is just an example and a picture from an in-person presentation. So we can provide impartial Medicare information in person to community groups and organizations, provided to the public, no cost to anyone. This information is free and impartial to help you be better informed consumers of your Medicare choices. But then we also, like Susan mentioned, we present to professional groups and employer organizations as well. There's a lot of times that we may present to a specific employer that serves clients that have Medicare questions, and we can be that reference to them and do staff trainings, including lunch and learns, or in the pandemic, we got used to lots and lots of Zoom trainings and presentations. So
And one
if
thing that has popped into my mind about professional groups and employer organizations is, folks, if you work for an employer that has several Medicare beneficiaries, or people who just want to start planning for their retirement, planning for your Medicare, and learning about what it covers, how much it costs, that kind of thing is integral to your retirement plan. So just last week, I did 2 virtual presentations. It was to a very large law firm who has an international presence, but I was presenting to their folks all over the country. And so that virtual, allowed me to do that. And we're happy to talk to your groups, even if it's a national company. We're experts in Medicare, and there are some rules for each state that are different from state to state, but we know which ones those are. So we can give a heads up to people that, this is the case in Indiana, but check in your state. So those kinds of professional groups and employer organizations are certainly on our radar, and we're happy to help.
Yes, absolutely. Okay, so talking about the virtual presentations, so you guys are watching one right now if you're tuning in, but we developed our Facebook Live presentations during the pandemic. So it was one of the ways that we adapted our outreach efforts, and in an effort to still reach individuals and provide that public education and outreach. So we're still keeping with it. We're still rolling with the weekly Medicare Mondays and the monthly What to Know Wednesdays. And then we save all of these presentations not only on our Facebook page, but also on our YouTube channel. And like Susan mentioned, she did 2 virtual presentations last week. And it's a great way when we do a virtual presentation, whether it be for a public group, for a conference. I've done that before, done a Zoom for a conference, or just general education, or a lot of employer groups during the pandemic were still providing that employee education and information programs. And so it is a really nice way. And we don't have to get out of our house. We can just sit right here, turn on our cameras, and do our presentation. So we definitely adapt to what the need is when it comes to presenting Medicare information. And the virtual option just gives us a way to reach more individuals without having to physically be there, the transportation challenges and all of that offers. And I don't know about you, Susan, but I think we're getting a little bit better at this virtual world. So, and I get to see Susan a lot more these days. See her. Okay. So like we mentioned, professional development can be some of the presentations that we offer as well. So there's lots of community organizations that we work with that may not have the staff available or the volunteer base available to have the SHIP program within them officially, but we will work with their staff members and educate them on Medicare and how to best serve their clients and community. And we have a lots of different topics that we can provide staff education on as well. And kind of depending on the season and the time of the year, may depend on what we focus on when we do have that group with us. And then we did mention our interactive presentations. And, our Facebook Lives are definitely one of our top interactive presentations. And that is virtual to a T. We're able to interact with you through comments, and you're able to see our reaction to those questions and hear our live answers. Even though we're not able to see you, we still feel like you're here and with us. And then one of our newer interactive presentations is Got Junk Mail. So we will set up and do a presentation on different types of Medicare mail that you need to keep, some that you can just toss, and then some that you can shred. And if you don't have availability to a shredder near you, usually at the agency or the organization that we're doing that presentation at, they will provide that shredding service for you. So it does get a little interactive because we're sitting there and talking through your options and going through that with you. And you're talking to a trusted source who's keeping all of that private for you as well. And then, Susan, I can't talk about Medicare Bingo. I have to let you talk about Medicare Bingo.
Well, yes, we play Medicare Bingo, and it is a fairly short, very interactive presentation on Medicare basics, but we can also tailor that Medicare Bingo to some specific topics depending on our audience, because we made it up and we can change it to what works best. So it's just a Medicare presentation in a bingo format, but everybody can play bingo and everybody enjoys playing bingo. And of course, what's bingo without prizes? So we always have prizes and we have participation incentives where we give away our promotional products or our giveaways when people participate. And there's a couple of topics that we cover in Medicare Bingo that get people really stirred up. And I always find talking about different types of fraud going on to get people really, really going and really sharing. So it's a fun time. All of the SHIP staff do it, and our partner agencies and most of our volunteers. So if you want to just do something fun and maybe just a tiny bit hokey, but it's hokey with a purpose. And I have yet in the, I don't know, I know I've hit over 1,000 in 15 years. I've hit over 1,000 Medicare bingos. I have yet to find somebody who didn't have a good time. So, and learn something. So yeah, just reach out to us. We're happy to bring Medicare Bingo to you.
Absolutely. I get to do one this week, so I'm excited. All right. And this is a list of not all the topics, but a lot of the different topics that we can focus on and do a presentation on, whether it's one of those virtual presentations we talked about, whether it's an in-person presentation, whether it's staff development or a presentation for the public. And Megan put this list together for one of our publications. I can't remember specifically which one that was, but this is not a full list. And Susan and I definitely kind of come from where we do our, we'll make our own presentations as well. And so sometimes if you don't see something on this list, or you're thinking of a need or something that you have questions about, we can always tailor things to that specific group or crowd. But a lot of times it's nice to kind of stick to these topics because Medicare is Medicare. It's nationwide. And a lot of these topics really cover issues on questions that we get pretty often. So just to kind of highlight a few, 7 things that Medicare does not cover. Everyone's always interested in vision, dental, and hearing. And so we can kind of talk about those things as well. 5 Medicare mistakes to avoid. Definitely a comparison on Advantage plans and Medigaps, and just kind of what are they, just kind of starting from the basics. And we do a lot of Medicare 101s, and during the fall open enrollment period, we'll do a lot of presentations based on that specifically, the open enrollment period, what to know, what changes you're going to see in the following year, and what things you can do during that time to your plans if you are a Medicare beneficiary. And like Susan mentioned, different employer groups, if this is also good presentations to have for people that are thinking about retirement and kind of what to plan and maybe those mistakes to avoid and just different things like that. So Susan, what are some of your presentation favorites to present?
Well, I really like to do the new to Medicare. It's a little, it can take a while, but I've done it a lot of times. I've done tons of new to Medicare. And what is important and rewarding to me when I do it is for people who come up and say, I didn't know anything about Medicare, and now I know some things, and I really need to rethink my retirement plan. I mean, just one quick example, I was talking to a group of folks who were customers of an investment company, and they host a new to Medicare a couple times a year that I do. And this couple had just acquired guardianship of their grandchildren, their minor grandchildren. And he covered the family under his employer group plan, but he was planning to retire so he could help take care of all these grandkids. And he thought Medicare was like an employer group plan and would cover his family. And so that time I had to be the bearer of bad news, but it would have been terrible for him to retire and them to be without an employer group plan option to insure everyone. So just, stories like that, we all have them about how something that we've presented or provided has really made a difference in somebody's life. And I like to think I can keep people awake mostly during those presentations. And sometimes there's even a quiz. So you never know what will pop up in one of our presentations. But I like that one. I'm looking forward to doing my what to keep and what to toss, my first what to keep and what to toss before open enrollment, because that is one thing that I hear a lot when I do presentations is, how do I make that stuff stop coming? And then, of course, we have to say, well, you can't, but you don't have to read it all. And of course, I like to educate on the assistance programs that help people in huge ways who are middle or a little bit lower income Medicare beneficiaries. So those are probably my top ones.
Absolutely. Well, I agree with you. I like talking about the Medicare savings programs as well. And it seems like, kind of like you said earlier, I've done several of those presentations, and I don't think I've been in front of a group where someone didn't come up and ask more questions about it, or maybe someone in the group qualified, or someone in the group knew of someone that qualified. And it's just really nice to be able to provide that education. And, we know all too well how life-changing it can be.
Right.
All right. So we've got exhibits and booths that we do. And some of my favorite things to do at the exhibits and the booths is to play games. So I created a ship game. So we have little toy ships in a little body of water, if you will, and there's ship questions on it. And so when someone takes a boat and they answer one of the Medicare related questions on that, they can win a prize or win one of our giveaways. And we'll usually help them out with the answers as well. But it's a great way to reach lots of people at one time and provide a lot of information, whether it be just sitting there and having a conversation with them, or providing them some written materials like a brochure or a flyer, including those Medicare savings programs. We always have those with us, and someone may take a flyer for themselves or a family member or a loved one that they think may be eligible for that. And I don't know about you, Susan, but I bring a stack of Medicare savings program applications with me, and I have helped several people at events apply for them just right there. So it's always nice to just be able to, educate, and then of course give people our awesome giveaways that we're always updating and getting innovative ideas. I was at a church the other day and handing out those Medicare savings program fans, and everyone was excited about those fans. So but we just love doing events, and they're long days, but they're fun days. And like Susan said, we do take our dog and pony show. We take all of our stuff with us and we set it all up, and we all have our own style. So you may just bop around to different parts of the state and you'll see how Susan sets up versus how I set up versus how whomever else sets up. And it's just fun to get out there and educate the public on Medicare. So
And I'd just like to promo a couple of things that are coming up soon, like this week. We are going to have, again, I think we've been doing this maybe 10, 12, 13 years. We have had a booth at the Indiana State Fair in the Indiana Home and Family Arts Building. I think it's called the Family Arts Building now. And it's right next door to the Hooks Drug Store. And we have our full booth. We may have a spinning wheel. Sometimes we bring out the wheel where you can spin it and win some prizes, and offer a lot of information, of course, on Medicare, the Department of Insurance, long-term care insurance. Sometimes Social Security joins us. Our friend from Hoosier RX joins us frequently. So if you are planning to come to the Indiana State Fair, go to the Family Arts Building. It's the quilt building and all of the crafts and the baking. So stop in and say hi, because we are there from 9 to 6 every day that the State Fair is open. And that starts on Friday. So we'll be out there. I will be out there with two of our coworkers setting up the booth on Thursday. Nothing like waiting till the last day.
Wow, that'll be so fun. I can't wait. I always like working the state fair. And then of course, when I'm at the state fair, I've got to get my living shake up. And then I usually switch it up on what my food item is going to be. But the mini donuts are a favorite.
Well, I've not had those two things, but I make my way around and have my favorites because I do work a lot at the fair since I live here in town. So yeah, if you're at the fair, tag us on Facebook and tell us what your favorite treat is. And I think we're all going to be doing that as we're working the fair and posting it on our Facebook page and our website. So give us a shout out. Also, Melanie mentioned those, I call them church fans. We do have available some fans, hand fans for churches. And so if you would like some for your church, just reach out to us. You can message us or email us. You can comment on our website or here on our Facebook page, or text or email one of the staff, and we will get some of those fans out for your church.
Absolutely. Yes. So I pulled up our website here. So I went to medicare.in.gov and I clicked on Ship Presentations and Events. It's the tab over here on the left side of the screen. And if you're wondering where you may find us, other than the state fair this summer, we've got lots of other fun events and activities going on and presentations at different of our community and partnering agencies and organizations. So we don't just do presentations, we also do outreach. I see right here in front of me that Deb's going to be going to a food pantry and providing outreach and volunteering her time there. And so we do lots of fun things. And if you're ever wondering where you may find a ship booth, presentation, exhibit, or maybe wonder, why was that lady wearing a purple polo, at my church today, or things like that, or gentlemen, I should say, you can look here on our website and you can see where we're going to be. So we like to keep this updated, and myself and coworkers, we update this once a week so that this list is pretty recent and it goes pretty far in depth. We have activities planned out through October already on here. So if you ever get a chance or you're interested, you can go to our website. Again, that's medicare.in.gov. And I'm going to show you a screen with all of our contact information so I don't have to remember it all.
Good idea. Yeah, we've been to county fairs this year. So if your county fair has not happened, it's likely there will be a ship presence there. And if our list of events and outreach opportunities just sounds a lot like a lot of fun to you, many of our volunteers staff our outreach opportunities and the booths and so forth. And so, as always, if you're interested in finding more out about how to be a volunteer and get in on some of our fun, just visit our website, the medicare.in.gov, and check out our volunteer tab.
Absolutely. Yes. And speaking of those fairs, I'm going to be at one tomorrow. So I'm excited to have my booth at the senior day at the Vanderburgh County 4-H fair. And we get ice cream at the end. So I'm super pumped about that. So, and providing information, to seniors in our area.
Absolutely. But the ice cream just makes it a little sweeter. I couldn't resist. Yeah.
There you go.
Hey, while we're looking at our contact page, I want to give a shout out to Wendy up in Porter County. She's joined us this morning, and she says that the pill containers, the little pill boxes we give out, are good for hearing aid batteries. And when people ask, well, what are these? And we say it's a pill box, and I usually say, well, I keep my Advil or Tylenol in mine. Now I can add or hearing aid batteries. Sometimes I say earrings if I'm talking to a kid, or, if I'm talking to a kid who's in tooth losing age, I might say, or you can always put your teeth in there. So hearing aid batteries has made the list. Thank you, Wendy.
Awesome. And Wendy just sent you a bunch of waves. So, and she gave us the weather today. So she's got sunny weather there in Porter County. So I'm glad it's pleasant. It's humid and rainy here. So, all right. Well, yes. So you see our contact page here, how you can get a hold of us. And then we did mention that it is our last July presentation. So we've got a pretty good lineup going on in August. And so we're going to start off the month with our Ask the Expert. So if you've tuned into that one before, this is where we basically set ourselves up to answer any and all Medicare questions that you may have. And we do our best to answer them. And if we don't know the answer, we will find out and follow up with you. But this is a super fun one. It's a real-time Q&A, and we invite you to participate in this one, especially if you have some Medicare questions that you want to get answered, or of someone that has a Medicare question, invite them to participate. But this is a super fun interactive presentation that we haven't done in a while, so it's time to bring it back, and just in time for right before open enrollment, when everybody's starting to think about Medicare more. So, all right. And then throughout the month, we've got some great lineups. We've got a speaker from Indiana Agribility. We're going to celebrate National Health Center Week. We're also going to introduce a new staff member of the Senior Medicare Patrol program here in Indiana. We're going to talk about insurance agent do's and don'ts. It's always good to be prepped for that coming into the open enrollment season. And then we're going to introduce one of our newest employees, Michelle, one of our public outreach counselors. So we've got a full packed month of lots of fun people joining us, lots of great information. And of course, you'll have your co-hosts, myself, Susan, and Megan. So thanks for joining us today. And Susan, do you have anything to add?
No, I will just hope to see everybody and their friends and family on Monday for Ask the Expert. Try to stump us. We're not afraid to say we don't know, but we'll get back later. So come with your questions, and don't feel afraid to ask anything you want to ask about Medicare.
That's right. About
you can ask us other questions too, but we might have to make up those answers.
Well, that's right. Well, with that, I think I'm going to wish everybody a wonderful Medicare Monday. I hope you have a great rest of your week, and thank you for tuning in. And don't forget, this is saved to our page if you know of someone that would benefit from this information. Thanks, guys. Take care.